Hello, my name's Joe. I'm a paramedic with the ambulance service. What's happened?
Hi Joe, I've fallen while I was playing football and I've injured my shoulder.
Okay. Do you know what you've done, sir?
It feels like it's popped out.
Okay, let me just take your pulse in that wrist. Is it hurting at the moment?
It's really painful, yeah.
Okay. On a scale of 0 to 10, 10 being the worst pain ever and 0 being no pain, how bad would you say it is?
About an 8 out of 10.
An 8 out of 10. And have you taken anything for the pain?
No, I've not taken anything.
Okay. Do you have any medical problems?
No.
Lovely. We'll pop you down to the hospital then.
Okay.
Hi, Mr. Monty.
Hi,
How are you?
I'm painful.
Oh, you're in a lot of pain. What happened?
I told the paramedic I was playing football and I fell over and I hurt my shoulder.
Okay, and on a scale of 1 to 10, 10 being the most amount of pain you've ever felt, 0 being the least amount of pain, where would you say you are?
I just told the paramedic about an 8.
Okay, did you receive any pain relief?
No, he didn't give me any.
He didn't give you any. Okay, and has this happened before?
No, it was the first time.
First time. Right, okay then. I'll can't find where the paramedic's right. I'll go and get you some pain relief now.
Okay, thank you.
Hello sir, I'm Valerie, I'm the radiographer. I'm here to take an x-ray of your shoulder.
Yeah.
You've seen the nurse?
Yeah.
Did she say you needed to have an x-ray done?
Yeah,
Yes?
both the nurse and the paramedic said that.
Okay. So before we start, I need to take a few details. Can you give me your name please?
It's Mr. Monty.
Okay, and what's your age?
I'm 17. I did tell the nurse and the paramedics this already.
Oh, did you? Sorry sir, but we have to do it. It's a legal requirement, I'm afraid.
Yeah, no problem.
Okay, thanks.
Hello, I'm Claire, I'm a physiotherapist. What's your name?
Mr. Monty,
And how old are you?
I'm 17. I've told everyone this so far.
Okay. Can you have a brief history of what's happened? I understand you've hurt your shoulder.
Yeah, I fell over when I was playing football in the garden.
Okay. Are you in pain at the moment?
A little bit. The nurse has asked me this and so has the paramedic. They've given me some painkillers, but it's still hurting.
Okay. And have you gone for an X-ray?
Yeah, I've had the x-ray, everything. They said it was dislocated and it's fine now.
Okay. I'm not sure where this information is. Let me just go and check and I'll be back in a second, sir.
Okay.
Hi.
Hello, Jess. This is Mr. Monty. He's
Hi, Mr.
17, and it looks like he might have done something to his shoulder. He's had pain
Right.
relief. There you
Okay
go.
then, okay. So, Mr. Monty, 17, dislocated shoulder. Oh, you said you got a pain score of 8.
Yeah,
Okay, and the paramedic's giving you some Oromorph painkillers.
yeah, he's given that,
Okay,
yeah.
that should take up to 20 minutes to work. What I'll do is I'll go away, I'll come back in 20 minutes and we'll see how you're feeling, yeah?
Yeah, that's brilliant, thank you.
Hi, Mr. Monty, how are you feeling? It's been 20 minutes.
Yeah, a bit better, yeah.
Feeling a bit better. Pain scale of 1 to 10, 1 being the least.
Probably about a 5.
5, okay.
Yeah.
I'm quite concerned about your arm. I'm going to send for a radiographer to come and give you an x-ray if that's okay.
Yeah, that's brilliant,
Yeah?
thank
okay
you.
then, they won't be long.
Cheers.
Hello Mr. Monty, my name is Valerie, I'm the radiographer. You're 17.
Yep.
And the nurse requested that you had an x-ray, hasn't
Yeah.
she? Okay, that's lovely, thank you.
Thank you
One
very much.
minute.
Hello, Mr. Monty. I'm Claire, I'm a physiotherapist.
Oh yeah.
I understand you're 17 years old and you've
Yep.
dislocated your shoulder.
Yep.
Okay, so you've been seen by the nurse, all your pain is under control.
Yep,
I
everything's
had an
brilliant.
X-ray and everything, that's all fine. So what I'm going to do is book you in for an outpatient appointment with us
Yep.
to come in about 3-4 days, and we'll give you some exercises and get you going. Is that
Yeah,
okay?
that's brilliant. Thank you
you're
very
happy
much.
with all of this?
Yeah, absolutely
Brilliant. Perfect.
Thank you.
Thank you.
I think the new changes have improved patient outcome. I think before the changes were implemented, we was all writing on white paper. It was difficult to see who had written what and where in the patient notes. Now we've implemented the change. It's much easier to see who's written what. With each profession is colour coded. It saves us asking the same questions to the patient over and over again. therefore reduces patient anxiety, and also I believe it increases the turnover of patients as well, because we're not spending so much time asking the patients what's been said by who.
Oh, the patients are happier, more relaxed, they actually become cooperative, and everything becomes so much easier and quicker.
I think a lot has changed, and it's for the better, because I have my patient's medical history before every examination, and with that information I can know my patient better and know if they're, for instance, allergic to contrast media.
I feel that the staff actually knew what they were talking about. They knew what was happening with me. It was quite kind of specific to me. Yeah, it improved a lot. They'd managed to actually realise what was happening with me and were able to actually talk about my problem rather than just repeatedly asking me the same questions. Yeah, it was just one big team. They all knew what was happening with each other and what was happening with me in relation to each other.
It was found through clinical audits and through evidence that our documentation system wasn't effective in allowing staff to communicate well with the patients, and in the end the patients weren't receiving the best care that they deserve. As you can see, I'm holding the new documentation system. We decided to colour code different sheets here. For each professional they have their own specific colour. They get trained to know who has which colour, and therefore it's easy for when you come to pick up the notes, you know which colour is yours, and you can find, if you say wanted to know what a doctor has said to a patient and you want to know that information, you know straight away where to look. We have done the training with staff, and we've done the pilot study. The pilot study did show some reluctance with staff members because obviously going through a big change like this, it is hard for the staff. We also decided to do leaflets for the patients to let them know what we were doing, because it is quite a big upheaval and it's a lot of change means there could be some problems along the way. So we're just letting the patients know as well that what we're doing is changing the documentation system. But overall, the staff were brilliant, and the questionnaires we received back were very positive, and we feel like we can expand and go further with this.